What's up, everybody? Trent Denson here. Spread the positive, doing a little 1200 Club member spotlight for my guy Jessy Casaus. Casaus? Did I do it? Casaus. Jessy is a guru at all things health insurance, something that I am very much clueless about. So we're going to just have a little conversation today about some of the latest trends in the market, what people can look out for, and just let people know Jesse's here to help you. So, Jesse, man, how you doing today?
Doing pretty good today. I mean, it was a unique day. Like you said, I didn't even know what day it was today. I took a couple of days off. That always throws me off. You know?
But you're back in the saddle.
Yeah.
Heard that. So, I know we were talking a little off mic, just some new changes coming down the line with, special enrollment stuff and Medicare and all the stuff you kind of specialize in, man. So, for those that don't know, be sure to go back and check out Jesse's episode, telling his story and kind of how he got into the health insurance world and just all the. It's a really awesome story, and obviously a big believer. So always want to give a shout out to believers in business as well. 7:30s at Cedar Glade Brews. Always looking for visitors. Come through, get a spirit-filled networking session in to start your Thursday. But yeah, Jesse, man, talk to us about what's the latest with all things healthcare, man, health insurance.
So yeah, now's the slow time. So no more of the open enrollment, hustle and bustle. So now it's just I spend a lot of times just kind of servicing clients, going through and just seeing what their needs are outside of just enrolling them in some sort of plan. So a lot of folks, they have questions about how their networks work, what benefits they could use, how does it work with the dental and the vision. So I'm just spending a lot of times just building those relationships with folks that have already helped out. There are some things that have been popping up in terms of special enrollment periods. So one thing I've been noticing lately in the market is that ever since, the pandemic, folks had to Medicaid and they were just getting renewed and no questions asked. And ever since, mid last year, a lot of people just been dropping off. So there's a lot of folks that lost their Medicaid. So I'm just helping them find alternatives, get them into other markets. And because they have that loss of coverage, they're able to get in a special enrollments. A lot of folks I've been running into, I've been bouncing around different specialty clinics and really helping out a lot of folks that have chronic conditions.
Okay. Yeah.
So like diabetes or heart-related issues, a lot of folks don't know that there's Medicare plans that are tailored just for those chronic needs.
Nice.
Helps them save money on their insulin and other medications related to just maintaining that. And don't need any enrollment periods for that. You can switch right into a chronic special needs plan any time of the year because it actually is better for that individual, so they allow that. So I've just kind of been finding that, seeing ways I can get into the community, help people just understand their coverage. There's a lot of folks going through their open enrollments at work, so that's one thing I do too. If you're employed and you get your stuff through work, I'll sit down and go with you and help you because a lot of times, the employer just kind of throws that at you and you don't understand it. And I'm more than happy just to help people walk through that stuff because my goal is just that you understand those services and maybe I'm just serving you just out of the joy of serving you.
Right.
But one day down the road, you might remember that, and we
100%.
reciprocate those deeds, and so it's fun.
Yeah, man, that's awesome. Yeah, because man, I just see that money go out of my account every month, but I have no clue what I'm paying for, and I've had broke my leg and it helped some, but I'm like, man, it's crazy just how it all works. So what are some things some people should be, or first of all, how can people find you? I always want to kind of plug that first and foremost because I feel like a lot of people, myself included, like have no idea what we're paying for, whether it's through work, self-employed stuff, all the above. So be sure to tell people like how to get in touch with you, obviously, and then just some stuff that we should like just common, 101 stuff we should be looking for.
Yeah, I mean, you can find me on all the social stuff, Prestige benefits and insurance. You throw that in Google with Jessy on there, it
There
should
you go.
pop up.
All right.
I have, I don't have a lot of online marketing. It's really just hearsay. I just depend on folks that I've helped. Believers in business, like you said,
Right.
come by, see us
Yeah.
Thursday mornings.
There you go.
And I try to stay active on social media. So within like Murfreesboro areas, you could probably always find me in there if you just throw my name in there.
Yep.
My first name is unique because that's the Y at the end.
Right.
I always said, "Why'd you do that, Mom?" But it's like, it just looks funny with a Y, but it looks fancy
unique.
too. But
Unique,
if you throw
man.
that JESSY in there, I'll probably pop up.
Yeah.
So yeah, I mean, it is what it is, man. It just mainly word of mouth.
Yeah.
In terms of like insurance, like health insurance, a lot of people don't see it. It's just this necessary evil sits there. They don't understand it.
Yes.
There's actually more financial planning that comes into it that most people don't prepare for.
Right.
Because they get that insurance and they think that they're paying this premium, and they're going to go to the doctor and they're going to use it and it's going to pay.
Sure.
But it's just not the case.
Right.
It's just like, I try to just compare it straight to the car insurance. You got that deductible, and God forbid you're in an accident, you got to throw that money towards that deductible, and then once you meet that, then they'll do whatever else.
Right.
The same thing with the health insurance. You know, and some of these deductibles are like $5,000-$10,000.
Right.
So it's like you're paying $100, $200, $300 a month out of your check. Maybe it's just coming right out because it's your employer, and then you go to use it and it doesn't pay nothing.
Right.
So what I like to do when I sit down and educate people on how the insurance works is easiest thing is the more you pay up front in premium, probably the less you're going to pay when you go to the doctor.
Okay.
The less you pay up front in premium, you're probably going to pay when you go to the doctor. So
Gotcha.
it's got to be some financial planning in there, So we sit down and we really go over a budget, make sure, that you have money that you're putting aside, for an emergency fund, so that way you have access to that if you have to go and pay a deductible
Right.
because you hurt yourself. So, I don't just do the health insurance. I really sit down and educate people on how it's going to work, what that cost is going to be, whether it be premium or even potential costs for treatment coming up, and really figure that out for them,
Right.
and see like how we got to put this money. We got to anticipate this, and even there's ways to fill the gaps. We got our guy Eric over at Believers in Business. He's with Affleck.
Right.
So there's some other things you can
Yeah.
put in play to help really kind of fill in
Awesome.
those gaps if there is an accident and your insurance is going to require that
Sure.
deductible or copay.
Sure. What about, just as far as, I think you're usually asking in Believers in Business for like the 65, fresh to Medicare, Medicaid. Talk to those people. Like, what should they be looking for? Like you said, people are dropping off and they don't even know about it. Like, how does that even happen? And then, how can you help those folks in those situations?
Yeah, so a lot of times, when it comes to the over 65 Medicare folks, they have a special program through TennCare. It's called a qualified Medicare beneficiary. It's a Medicare savings deal. And there's different tiers to that. So some folks, they just had a tier that just covered everything. So Medicare doesn't cover it all. Medicare has deductibles and co-insurance and all that stuff too. And people are on a fixed income. That's why I really love to reach out to that crowd, because that's the crowd that they have little resources and they're not as savvy on the computers.
Sure.
And all, able to jump on and research all this. And they're not told. When they sign up for Medicare, they're not told. They just get a card sent to them in the mail. You're 65, here you go. And there's things they have to do, otherwise they get penalized. But what I found, when I researched it a little bit, it's just ever since they did away with the pandemic stuff, Medicaid just started dropping people. And it's been doing this for the last year and a half.
Wow.
And a lot of people, even if they got a bump in their Social Security, so a lot of folks did get a bump in their Social Security last year, and it was like $30. Unfortunately, that $30 threw them off into that tier because it's just a small little cushion, that they have federal poverty guidelines that they abide by, and if you make 100% and they have the dollar amount, and it changes every quarter. So you don't really know. I mean, it's like you have to have somebody advocating for you. Like I tell people when I sit down with them and we're going over their plans and all their options, I said, look, all this stuff, it exists out there. You go and do it yourself. You can find anybody to do this for you. You know, what you get when you work with me is you get me.
Yeah.
Because it's not me that I don't work for the insurance company. So,
Right.
you know, I work for that individual, and you have me to advocate for you. So if something changes, something weird, you got a guy that is looking at these different guidelines every quarter when they change, or every year when the market shifts or the plans change.
Nice.
You got that guy that can call you up and say, hey, we had to change.
Right.
You know, this is what we should do. Let's take a look.
Sure.
So that's what I found is just a lot of people are getting kicked off, even whether their plan is changed and fell off altogether, or they just qualify for a different level. So
Sure.
Tender's got another level where it just pays your Part B premium. So again, Medicare is not free. You know,
Right.
you worked your whole life, you paid into it, but you still got to pay
Man.
for Part B, and Part B is what everybody uses. It's go to the doctor, go to your clinic, and you know that's what it is. It's $185. It goes up every year. Last year it was less. This year's it's more. Next year will probably be more again.
Man.
So a lot of people can't afford that. You
Right.
know, their Social Security is $800-900. I think the average I see is about $1,400 a month fixed. That's it. And they take that 185 out.
Yeah.
You know, and when people get qualified with these, they call them dual plans. So when you have Medicare, you have Medicaid, it's called dual eligibility. And they have these special plans. And a lot of people don't know is that you can get a Medicare plan that has all these other things bundled and wrapped into it, like dental and vision.
Right.
On top of that, you can get flex cards where you qualify for over-the-counter credits. You go get healthy food. You can get even sometimes ride share and things like that, because a lot of times you can't drive yourself.
Right.
And what happens when that Medicare plan has to change if you lose Medicaid? And sometimes they just kick you out. They send you a letter in the mail. You know, you might not be out there checking your mail every week. You know,
Sure,
might get
yeah.
lost. Maybe, you know, I talk to people, they live in apartments. Half the time they get their mail. And they don't know.
Yeah.
They just don't know. So I work with a lot of clinics in town that service these folks, and they come in and they have cost estimated for them. And I've never had to pay anything. I got TennCare. No one told them that their TennCare changed. And now their plan that was made to work with the TennCare, instead of passing that to TennCare, is passing it to them. So these Medicare plans, they offer a bunch of those fringe benefits. I mean, some folks get $100 to $200 every month in over-the-counter credits to buy food and medicines and vitamins and things like that. And the reason why these plans can do that is because they cost share with TennCare. They send 20% over to TennCare. TennCare is expected to pay it. So that insurance plan doesn't have to cover everything. They can offer more benefits. When you lose TennCare, nobody's paying that. It's passed on to the member. So and you know, again, these folks are in some of the worst shape because they barely just got out of the scope of TennCare. So that means they are low income.
Sure.
You know, they need these services.
Right.
And they probably just lost TennCare by about $30-40, and then they're expected to pay 20% of all their services.
Man.
And nobody told them. They just get that surprise when they get the bill, or they show up at a clinic. So that's why I always ask, like, with a 65 for the people, because they're the ones that really they're just not in the know, and it feels really rewarding when you can get in there and you can tell the folks, because again, I always, you know, the first thing I ask people is, did anybody explain how your Medicare works when you got it?
100% of them are,
You know,
no.
and they don't. They just don't know. They think it's just, man, it's going to be free for them, and you know, and I wish it was. You know, in a way, you know, in a way. I mean, I am a capitalist, and I believe that, you know, but that competition would drive down, you know. So I don't necessarily want to just have universal healthcare for everybody, because it'll have to get paid for one or the other, and taxes will go up. But that's a whole other story.
True. No, that's good, man. That's great information for folks to, you know, and I know my parents, they were fired up when they got, you know, to that point, and I think they've learned. My dad's super up to speed on, like, he does his homework on everything. So, I know he had to navigate that himself, and he did, but, anyway, to your point, like 99% of folks probably just have no idea. And just how, man, it really is crazy that's such a unknown for so many people. And especially when, you think you get to that level, you're like, finally, and then you have this whole new learning curve of, man, it's crazy.
It is tough for some folks. Like I've been with people recently that they're like, I don't think I'm going to get I'm not going to pay out. I can't, you know? I mean, you got a job, and you usually when you retire, you turn 65, you're going to draw your Social Security. It's going to be a fraction of what you earned from your income from your profession, and then usually you're paying your insurance through your profession, and by law, typically the organization you work for, they got to pay 50%. You get your share, but like you can get insurance for your whole family for $185 a month, and then you retire. You're gonna get your Social Security. It's a fraction of what you're earning, and then you got to pay $185 just for yourself for Medicare that you thought was just gonna be
that you've been paying towards all.
So it is, for a lot of folks, it's a lot more expensive than they think.
Yeah.
And if you're in the middle and you don't know that, I've had people say that they weren't gonna even get it until I was able to talk to them and explain, like, there's things we can do to reduce that monthly premium for you, whether it be through TennCare in the state, or even there's special Medicare plans that actually, they call them give backs, and they'll give back a portion of that premium to reduce your Part B premium. A lot of folks don't know that, because if you're in the middle, you can't qualify for TennCare, but you still don't make enough money, and that 185 hurts you, because the financial planning aspect comes into play too. It's like you get to sit with folks and explain to them how we can make up this 185 for them so they can have the health care they need.
That's awesome. How what are some of those strategies, or can you speak on that a little?
Some folks have a little bit of money lying around, so if it's taking some money and maybe moving that into an account, that'll pay kind of like a pension, so for certain folks, sometimes like a fixed indexed annuity is really good for them. If they have a little bit of money, they can move that in an account, and they can pay them just more of a monthly payment, which will kind of decrease their liquid asset in the bank account, but still provide them monthly income.
Sure.
And then maybe that gets them into scope where they can qualify for a TennCare.
Oh, got you.
Or maybe it boosts their income so that way they could pay the 185.
Sure.
So just little things like that, or just it's really not a lot of options, but that's usually one. If people are holding on to money, you can get those into an account that'll kind of play around with your income and remove it as being liquid asset, because they want a certain amount of money in the bank. If you have more than that, then they just automatically deny you for TennCare. Wow. But if we can just boost that, then maybe the 185 is not so bad. Or going into a give back plan. There's plans that Tennessee has to offer that'll reduce your Part B premium by up to $105.
Wow.
So instead of 185, you're looking at $80. And
there
a lot of times that even is just enough for people to say, well, I could afford 80. 185, I don't know.
Sure.
And then be able to walk through them the whole way and really see, like, how they can save money even going to their providers.
Sure.
So since I have a background in healthcare, and I've done that for about 10 years as a financial counselor, different hospitals and clinics, I know the resources they have as well.
Right.
So I got to gather that info anyways, where you go on, what doctors are seeing, what meds you're on. I can find other little subsidies and deals through those facilities to reduce their costs as well. And I'll advocate on their behalf for them and do that, because it's really a simple process.
Right.
Just got to get on the phone with these folks and figure out how they qualify.
Got you.
And it's worth it to me to do that for people, because if you leave it to them, a lot of times they're in a place where they just feel defeated.
Yeah.
They're like, I don't know how I'm ever going to get to retirement.
Sure. Yeah, that's tough. That's awesome though. I really appreciate your passion for this, because it makes my head hurt just thinking about the stuff you deal with on a daily.
My head hurt too sometimes.
I feel that. You mentioned special enrollment. Open enrollment just closed. Special enrollments are still happening. Do those happen throughout the whole year, or how does that work?
That is individually based, so it's so Medicare is weird. It has its annual enrollment, has an open enrollment. So you got these kind of two enrollments. When it comes to the ACA, so ACA is like the go-to now for any insurance outside of your job. There's still private insurance companies. I don't like to go to them first because they have a lot of exclusions now. So there's pre-existing exclusions. Sometimes they're only you can only have the plans for 6 months. They just not might not cover a whole lot, and a lot of them are just limited benefits plans. Period, or they are reimbursement plans.
Gotcha.
So where you would actually go into a facility and maybe they don't have the ability to bill direct, and then you would get reimbursed that money on the back end. So a lot of different things like that. But the ACA, they do have special enrollment periods, so that's why they're there. They cover all pre-existing conditions, and they are somewhat based on your income. So if you're in that middle range where you don't qualify for 10 care, but you got some dependents and you have some income, you're going to do your taxes, you really can get good plans on there with very low deductibles and out-of-pocket expenses, and you're going to have anything that's pre-existing coverage. So if you're already getting treatment through your employer plan, they're not going to exclude any of that.
Cool.
And it's either you have a baby, you get married, you lose coverage, then that qualifies you for special enrollment period.
Gotcha.
Because you're adding, there's a change. Just like with your employer, you can add a spouse. If you get married or you have a baby, you get to add that person to your plan.
Right.
Medicare is a little different because you're typically not getting married. It's an individual. It's just on that one individual. So their special enrollment periods have a lot to do with if you lose the 10 care. So like a lot of these folks that lost 10 care, a lot of times they don't do nothing because they think, I gotta wait for that open enrollment period. Well, nope, you just had a change in your 10 care, so now that qualifies. You can go in there and change that plan. And then the chronic conditions stuff. So there is the chronic conditions. Typically, it's diabetes, heart-related issues, and even end-stage renal disease. So it wasn't until a few years back that if you have kidney failure, you get Medicare, and you couldn't get an Advantage plan. So now you can, and there's actually companies now in Tennessee that are offering special plans for that. So it is those are special enrollment periods. So I could switch anybody to a chronic special needs plan at any time of the year.
Wow. Okay.
If they were getting high-end medications and they had subsidies for those medications and somehow they lose that subsidy, that qualifies them for an open enrollment period. So, and it's really easy to find them for Medicare patients. So easier than a lot of people think because they sit around and they wait until that November comes around when they could have actually bettered their situation a whole lot sooner.
That's awesome. That's some good stuff, man. Man, you're so knowledgeable with all this stuff. I mean, obviously it's what you do, but man, like I'm just like, that's impressive because there's so much to keep track of and it's always changing and all that, man. That's it's awesome that you have that knowledge. So again, folks, if you have questions about your insurance, call our guy, call Jesse. Just put Jesse Prestige Benefits in your Google and he will pop up. As always, man, super grateful for your support in the 1200 Club. We're going to be doing this, on a monthly basis, so stay tuned. We'll just literally have a Jesse tab on the STP YouTube page to be able to follow along. If you have any questions about health insurance or you do life insurance too, right? You want to speak on that?
Yeah, I do a bunch of different insurances. So again, like a lot of times I walk through folks through their health insurance and they do have questions about other insurance, whether it be final expense, term insurance, things like that. So I do a little bit of financial planning with these folks. A lot of times I have to figure out ways to get, for them to be able to afford their plans. And it's just another service. I'm in this not because I love insurance.
Yeah.
It just so happens that I've been in healthcare for a long time, really learned it well, and it's kind of a necessary evil. And I just decided to get good at it, understand it,
Smart,
and I just want to
man.
help people. So,
man, that's awesome.
And that's why I do it. I just want to make sure people are in a better situation. I always want people to be in a better situation after they have met me.
Man,
whether it's just
beautiful.
an encouraging word or helping them with their finances and insurance.
Sure. Well, that's what we're about here. Y'all know, spread the positive. Good people doing things the right way. for the right reasons, man. Thank you for what you do. That's it's always so. I love doing these, man, because it's literally everybody that does this has something that they're deeply passionate about, and obviously serving people is near and dear to your heart, and something to celebrate, man, because it's a wild world out there, especially in the industry you're helping people with, and the service and the care that you provide people is really something to celebrate, man. So thank you for what you do. Thank you again for your support with the 1200 Club. Be sure to check him out, Jessy Casaus. Casaus. I got the sauce at the end. Casaus, Casaus, on Google, and obviously we'll have all of that in the show notes. So reach out to our guy. He's here to help, here to serve, and ultimately really keep you informed on what you're paying for in the wild world of health insurance. So Jessy, man, I appreciate you, and we'll wrap this one up.